Good evening, folks. Welcome to another brand new spanking edition here live, Liberation Lighthouse, with your host, Mr. Christopher Plow, and myself, Rod Pimentel. On tonight's episode, we're going to be talking about something that's called Special K in the disco, not disco, it shows my age, right?
Disco. Dun,
Yeah,
dun, dun,
in the
dun,
rave
stay
scene.
alive, stay
But
alive.
for those of us in the therapy world, where we're studying therapy, not doing it. Well, I'm going to therapy. Uh, it's known as ketamine therapy.
hmm
So, any thoughts or ideas, Mr. Plow?
I think we're off to a fantastic start. We already have like a little disco going on. We're like throwing around slang drug names. I think we're ready to rock and
There we
roll on
go.
this
I
one.
feel like I could go to a rave now. Yeah,
100%. I'm back in South Dakota, so we got like the lights that are going on here in the background.
sweet.
In my beautiful double wide manufactured home.
Hey, I think it's awesome. And I was just commenting to Chris, the lighting on the back gave me flashbacks to a TV show when I was a kid and just shows how old I really am. Once upon a time, there was a show called Kung Fu with David Carradine. And on the scenes where he was having flashbacks to his trainings in China or wherever he was supposed to be, there was a master of sorts sitting in a room lit with nothing but candles. So you don't really see the room; it's just darkness and this amber lighting of candles. And I was having flashbacks to that. Just looking at all the lighting behind Chris there. So maybe I am in need of
Which is
ketamine.
not surprising. Like this is a room I've done a ton of meditation in, a lot of my own self exploration and understanding of self, uh, diving into the unconscious, journaling, writing, etc. So it's a bit fitting.
It is. It is. Maybe it's just subconscious in my end because I too have gone and spent some time in that room and meditated and so forth.
Yeah.
So tonight's episode, ketamine
Dun dun
therapy.
dun.
Dun, dun, dun.
Ketamine.
And we
Uh,
are on season 2, 2022, episode number 2. So ketamine, what is it? Ketamine was first FDA approved in the 70s and is considered an essential medicine by the World Health Organization. That's the WHO, not the band, but the World Health Organization. The safety profile is such that it is commonly used as an anesthetic for children. Yes, little kids get ketamine when they have to have surgery. Currently, ketamine is the only psychedelic substance available outside of research for use in clinical practice. Over the last decade, medical providers have successfully used ketamine in outpatient settings for the treatment of a variety of mental health conditions, including treatment resistant depression, anxiety, PTSD, and chronic pain. And this thing has gotten so popular that just up the road from where I live in Santa Fe, New Mexico, there's this spa, if you would. It's called 10,000 Waves. And within that spa, they have a ketamine clinic that's being provided by medical professionals. But it's just showing you how in the mainstream this has become or is becoming.
Yeah, so I think that the two things interesting about it are number one, it's been used for a long time, so it has a long use history. Um, uh, it is relatively safe compared to some other things, and it's becoming very prevalent, especially in the United States. One of the things that's likely to happen is all the places that are utilizing ketamine and ketamine therapy are also often preparing for some of the other medicines that will, when they're legalized, be able to be introduced into the same settings. So there's a little bit of a like a groundbreaker, an icebreaker in utilizing ketamine therapy, and then what that enables for other substances, other medicines as they become legalized as well.
And ketamine, of course, is a psychedelic. Thus, the rave or party or disco crowd trying to use it illicitly. However, yes, it is supposed to be a medicine. It's supposed to be an anesthetic, and it's also been found to be great in the treatment of depression. So, ketamine for depression. Many people know of ketamine as a hallucinogenic and addictive street drug, which one abuse can put can put people, if I can read today, can put people in medical peril. You can OD from it.
Yep.
Today, doctors are increasingly looking to ketamine as potentially life-saving treatment for people with severe treatment-resistant depression who may be at high risk for suicide. That again, for if you are treatment-resistant, meaning that the talk therapies and the other medications are not working for you, ketamine might be a solution. Currently, the use of ketamine for depression is an conditional. It means that although ketamine is approved by the FDA for some medical purposes, it is not approved specifically to treat depression. However, that soon may change as we are looking into newer and more studies that are happening. Under its fast-track drug approval process, the FDA is reviewing the results of clinical trials of esketamine, a ketamine-based nasal spray to treat depression. That is, it looks just like an allergy medication type of thing.
Right.
On a note, the IV treatment that they would use for treatment of depression, the dose is not going to kill you. It's not high enough to cause anything bad, but it should be good for anywhere from 4 to 6 weeks, so that you're not feeling the symptoms of depression. The nasal spray, on the other hand, is a daily thing. So you would have to snort ketamine on a regular basis. Okay. For now, people who undergo ketamine treatments for depression are typically receiving the drug at specialized clinics intravenously as nasal sprays, through rapid dissolved tablets, or intramuscular injections, which is a shot. Effects from the nasal spray, as we said, last only a couple of days or not even a day, while intravenous treatment may last for a few weeks to a month. In all instances, the dose is significantly lower than if it were to be used for anesthesia. And again, it's not high enough to. It's not high enough. The dose is not high enough to cause you to hallucinate, as if you were in a party environment type scenario.
Yeah, to speak to this a little bit, number one is any medicine that you're looking at using a professional setting, like, as much as possible, professional setting. But some substances have an MD50, like an amount that you can take that causes mortality, i.e. die. If we're looking at things like MDMA, ketamine, etc., they have those lethal doses. If you look at some things like cannabis, psilocybin, etc., not really. There are lethal doses, but it's almost impossible to consume that much physically. So knowing that those things exist, you can become very careful about dosages and everything else. In my experience, I've only done ketamine a couple of times in tablet form. It's interesting. It definitely numbs your mouth and everything else. Becomes an interesting experience that we'll talk a little bit more on later. But where I've seen it helpful for some people, especially in the treatment-resistant depression, is it's a psychedelic, but it's a disassociative. So it almost like takes you outside of yourself. And so by viewing yourself outside of yourself, which is a lot of what the meditative practice is, it's like being the witnessing what you're doing without being like consumed or everything else by it. It gives you some perspective on things that are happening in your life. And also for some people, it can also be a bit of like a nervous system reset. It's almost like you turn off the nervous system and then you turn it back on. It's like rebooting your computer, rebooting the modem. And sometimes when you reboot it, things work better and work well for a while, right? The advice I would give is it's not necessarily a cure-all, right? What it's doing is it's like a reprieve for a period of time, whether this is the daily nasal sprays or you get 2 or 4 or 6 weeks, a reprieve from the symptoms of depression, for example. In that space, then you can actually, feel good enough to be able to go on with your life. But more importantly, you can also then focus energy and attention on resolving the root causes of a lot of that depression, right? If you don't, then it's just going to be the cycle of utilizing the drug over and over and over again, which is better than nothing. But I personally don't want to be dependent to anything, right? So I think of it as a reprieve from the challenges that you're having in life, a reprieve from the heavy, like suffocating blanket of depression. And then from that space, getting back to like a more normal type of perspective, maybe even an elevated perspective, but then being able to put your energy for a period of time into truly understanding, truly healing yourself, truly resolving some of the core issues so that you can then go forth and not need to continually take any medicine, including ketamine.
On that reprieve part, yes, all the research that I did indicates that this is not a one and done. This is not a two or three and done. If you decide to do ketamine therapy, this has to become a monthly practice for you, or if you do the nasal spray, it becomes a daily practice for you, um, until you figure it out, or the end of time. You know, if you're taking the medicine and you're feeling better and you're not really working on the root causes, as Chris explained, and everybody's got different root causes. You're just gonna have to continue taking that medicine. Otherwise, it all comes right back. It's helpful in keeping the symptoms at bay, but it won't take them away. Okay,
Now,
so keep that in
sometimes
mind.
it is mixed with, they call it ketamine therapy, which is usually the administration of it. Sometimes it is actually mixed with therapies as well, like a therapist. Um, and in that space, you have the experience, you get the perspectives on life, talking them through and integrating them along with a therapist. So it is possible to use ketamine in a setting that allows for more than just a symptom reprieve, but
Okay.
it's not always done that way. So wherever you're going to have ketamine therapy, if you choose to do it, if this really is one that like resonates with you, you feel it, it's worth trying for you. Also look at, what is the process? Is this just the administration of the drug and making sure that you are safe, which is awesome? Or is it also go further? Is it involving some therapy beyond there that helps you move through whatever challenge or block or trauma
Trauma.
has happened
Yeah.
in your life in order to truly step forward and be more free? Like I keep thinking this thing is, the more I can let go of, the more I can resolve, the more I can integrate, the more I can, whatever word you want to use, like heal, right? The freer I get to be. And the freer I get to be, the more I get to enjoy life. And so that is a driver for me in many of the things that I do. It doesn't have to be for you, but it's something to consider.
Yeah. So, how does it work? Studies have shown that ketamine is effective in treating people whose depression has not responded to other interventions, such as it's called treatment resistant depression, is
Mhm.
estimated to affect anywhere from 10 to 30% of the people diagnosed with the condition. Experts believe that ketamine works through a unique mechanism directly modulating the activity of a brain chemical called glutamate. Glutamate is believed to play a role in stimulating the growth of new brain connections that may help alleviate depressive symptoms. People who have taken ketamine to treat their depression experience varying success depending on their personal history, how long they've been depressed, how severe their symptoms are, and how many drugs they've tried without seeing improvement. For people with less severe depression, ketamine may be effective in as many as 60% of those who try it. Among those with more persistent and significant disease, a smaller number, 30 to 40%, may experience relief. And then, of course, there's people that, for whatever reason, ketamine just isn't going to do anything for them.
So
Okay.
I think one of the reasons for this, like if we start talking about depression, depression is one of those words that you put out there, and it describes the experience. Of course, being depressed, not having the energy to do things, lot of motivation. But there are many causes for what depression can be. There are physiological, neurological causes for that. It could be like the wiring of the brain. There are hormones and neurotransmitter causes. Your brain just isn't like doing the neurotransmitters or uptaking them or utilizing them or producing them well, which can tie into gut health because many of the neurotransmitters like serotonin are created within the gut. It could be because there's just deep emotional things that haven't been processed, and there's no physiological reason for it. It's purely an emotional thing. There's a lot of causes that can come in that can create the depression experience. And so the reason a therapy like this doesn't work for all of them is because it addresses some of them, but it doesn't necessarily cover all the causes. And this is where finding the therapies that work best for you, like creating your own tool book, your own like toolkit, your own path in this is important. Remember, ultimately, you are the one in control of your life. And you get to choose which of these you use, and you get to go through the experiences and find out, like, is this the one? Great, this is the one. This works for now. This really helps. This didn't work for me.
And
As
it might
Rod, I
be a
think,
trial and error and then coming back to.
yeah.
Just like cannabis was not a good tool for me once upon a time when I first tried it for anxiety and PTSD. And then just later down the road, as I was using it for joint pain, I found that it actually helped with the anxiety. So definitely, if you've tried ketamine and it didn't do it for you, way back in the past, and you want to give it another shot, it's available. It's not cheap, but it's readily available, almost as available as cannabis is these days.
Mhm.
You just have to do a little research for your area, find out which clinics are
All you
near
got to
you.
do is find out the local disco. Dun,
Yeah,
dun,
find the
dun,
local
dun.
disco. Not gonna let me live that down, huh? All
Oh,
right.
it's gonna be fun.
The expectation should not be that it will magically cure depression, and everybody, everyone, and every body is different. In low doses, ketamine produces a surge in glutamate, which encourages the growth of the brain's synapses. With this increase in glutamate, the neural connections in the regions of the brain that are affected by depression are stimulated, strengthened, and restored. The brain circuit function is improved from these strengthened neurons that have previously been stifled by depression. Kind of weird that all the stuff that goes in our heads, it's just
Yeah.
amazing to me how much wiring we have.
So if you look at it, and I'll let you continue in a minute, like one thing I find fascinating is when you start to look at brains that are experiencing depression or other type of disorders, like literally you can find that areas of the brain aren't necessarily connecting to other areas of the brain in the same way a quote unquote normal brain would. There's no normal brain, but the statistically normal brain. And so when you start to get into things like ketamine that stimulate that the growth of brain synapses and everything else, or things that we'll talk about later on, like magic mushrooms, psilocybin, even LSD, they promote not only the growth of synapses and neurons, but also in the interconnecting of parts of the brain that normally don't fire together or aren't firing together really well now. And in doing so, allow for a more normal brain experience, if you would. And this is the same in some ways as when we talked about before. I think it was 2 episodes back. We talked about the neurofeedback devices, right? The neurofeedback devices are doing much the same. They're helping parts of the brain connect to other parts of the brain, and reinforcing those neural pathways, so that on a physiological level, your brain begins to act more normal, more beneficial to, let's say, the everyday experience.
Good. I like that. I like that. Researchers have also identified molecular changes with ketamine treatments related to G proteins. People with depression typically have a high amount of G protein accumulated in lipid rafts on cellular membranes where they are inactive. SSRIs push the G proteins off the lipid raft and back into useful activity. However, ketamine forces them to activate much faster in minutes instead of weeks and keeps them in action for much longer. So you're basically jump starting this sucker.
I'm seeing that, but I'm also like imagining like these little
Like,
because I haven't seen this before. These little G proteins in brain, they're just like yo, man, I don't want to do anything. I just want to hang out here. Like the ketamine's coming in, it's like, yo, get to work. Like, come on, get out of bed,
Well,
lazy.
maybe the deep proteins are also depressed, and that's what's causing the depression.
Yeah, exactly. They just need a little special K and they're less depressed.
Yeah, yeah. Go party at the disco.
Yeah.
So, who should not use ketamine? Okay, I'm not telling you who should. I'm telling you who should not. So, again, if you go to a local clinic and they're like, "Yeah, ketamine's for everyone," you should probably walk away from that clinic.
Yes. Like
Yeah,
go someplace where they're discerning. They want to understand you. They want to know what you're going through. They're helping you understand if this is truly right for you, not a, hey, you walk through the door, let's shoot you up.
yeah. We only take cash.
Hmm.
So, among those who should not use ketamine are people with a history of substance abuse, history of psychosis or dissociative disorders.
So
Ele-
this one, I just want to jump on for a minute. Um, my understanding, and again, the things that I understand are relatively small compared to the things I do not understand. But my understanding is the reason around disassociation in particular is because some of us, I know that I've experienced this. Disassociation was a coping mechanism that I developed in order to not have to feel all of the emotions that were too powerful for me as a kid, right? And so you kind of like detach from it and not have to feel everything. Part of my healing process has been reassociating with it all, feeling all the stuff I didn't want to feel. But because um, ketamine is not just a psychedelic, but it's an anesthetic and a disassociative, it can promote that experience. And if you already have like a prevalence of disassociation, more so than just I detach a little bit, but a true dissociative disorder, then it may be super counterproductive for you. And so you just want to be careful about that. If that's your experience, definitely talk with a couple different providers, get a real sense of where they feel that you should be. And only if you really, really, really feel comfortable, like in your gut, this feels right, should you move forward with it.
right, right. Elevated blood pressure, because ketamine itself will elevate your blood pressure even more. And any uncontrolled medical condition, again,
What does that mean?
we don't know what your physiology is like. If you have any heart palpitations, if you have trouble breathing, if you have any kind of medical condition that probably keeps you from sports or exercise, the little disclaimer: don't do it, or at least don't do it until you check in with a doctor. Okay,
Um,
we want to make sure that you're doing this safely if you do decide to give this a go.
I think this, I agree with you 100%. So you're absolutely right. I'm glad you put this in there. But yet uncontrolled medical condition also kind of feels like if I laugh too hard and I pee a little, like, like
Is
it's a
that a
bit
medical
uncontrolled.
condition,
I don't know. Like,
or is
I
that
think I
just a
should.
weak bladder? No, I guess a weak bladder would be a medical condition. You know, but the idea is, look, if there's something wrong with your physiology, and you're gonna jumpstart something,
Yeah.
we want to make sure that parts don't fall off or break.
Yeah,
Okay.
all jokes aside, again, this is one of the reasons that the eventual legalization and standardization of some of these things is really helpful, right?
Yes.
Because Freddie on the corner isn't going to be like, yo, are you taking like blood thinners? Are you taking like high blood medication? I don't think you
Do you
should
have
snort this.
diabetes? Do you have high
Do you have
blood pressure?
diabetes?
Yeah.
Yeah,
Yeah.
exactly.
No.
So a
High
little
cholesterol.
more guidance around those from medical professionals can be really helpful for
Yeah.
everybody. Yeah.
Yeah. No, Kenny with a special K ain't gonna do it. So, who can benefit? Because the medication is being used off label for depression, there are no clearly defined safety recommendations either for home use or for its use in specialized clinics. That doesn't mean they're not doing it safely, and that doesn't mean that studies aren't being done. In fact, as we are speaking, more studies are being done and presented to get further approval. We now have clinics that specialize in this, so don't do it at home. Don't do it at the rave. If you actually want the therapy, you have to choose your setting, right? You have to choose your setting. You need to do it at a clinic. That means that it's up to the individual providers to guide the patient in making informed decisions about the treatment. Again, Kenny with a special K is not looking out for you. He just wants your cash. Choosing a qualified provider is essential. The Journal of American Medical Association in Psychiatry published a statement, and I don't even know if that's what JAMA means. I think that's what it means. It published a statement in 2017 outlining the best practices for doctors to follow in ketamine treatment, such as performing a comprehensive assessment, obtaining informed consent, you always have to have consent, and documenting the severity of depression before starting the medication. These guidelines are aimed at increasing the safe use of ketamine for depression, and providers can use them to help ensure that the treatment is a good match for your condition. Everybody and everybody
is different. I love that we've got that, and we'll say that over and over again. Everybody and everybody is different.
Yeah.
And for those who benefit from this, why it's worth and why we're sharing this. One is it's very prevalent. It's one of the reasons we're sharing this particular medicine and this particular treatment. But the other thing is for those that this works with, this can truly be like a night to day difference in the experience somebody has for a period of time. Truly can be life-saving. So if you truly have had depression and it is treatment resistant and other things have not worked for you, consider this. Go through all the steps that we're saying. Get a good provider. Make sure that they care about you. Make sure they're understanding your medical history. Make sure that they're making sure it's a good match for you. But definitely keep it on your list, because for those it works for, it can be powerful.
Right. And if you're on other antidepressants and if you're on other medications for other ailments, keep in mind that you are mixing a lot of meds. So you want to talk to somebody about doing this safely. We don't want anybody to have, some kind of a reaction because for whatever reason, ketamine didn't work with one of your meds that you need. So if that's the case, talk to your provider about either getting you off that medicine if you'd like to try ketamine, or not doing it. It's just as simple as that. Your life is too precious to go out and just try stuff on a whim. So do the research, get the backing. I see a little grin from Chris because he's tried a lot of stuff on a whim. But
not on a whim. No.
No.
There's a joke here, no doubt. But the truth is, I started experimenting and understanding this stuff well before anything was legalized, before there was any access to anything, before I knew anybody else who was doing a lot of this stuff. And I am very grateful that I have a mind that was like, how much of this should I take? This online forum says I should take, I don't know, make up a number for something, a gram. What's a tenth of a gram like? Let's try that first. Yeah, exactly. Because everything on the internet is true. There is a website though that is worth bringing people's attention to. I'll share this multiple times, but it's Erowid, EROWID.org.
Can you type it in the message and so we can display it for our viewers?
I can't actually.
Oh,
it doesn't allow me to type into our message there.
On. Let me see if I can.
Yeah.
So is it a www, HTTP?
Yeah,
what are we looking at?
HTTP. Here, I'm gonna bring it up right here. Erowid.org. So just HTTP / EROWID.org. And then the other place I would guide people to for this stuff is maps.org, MAPS.org. Those are two great resources for understanding what other people's experiences have been. Erowid is more, let's say, crowd sourced, like people are just sharing their experiences, and it's often not in a therapeutic session. So it'll give you some context, but be very careful. And MAPS is all around the legalizing and sharing what the therapies that are being done with research and studies, along with therapy, along with doctors, what that's like. So it gives you two very good views of how these medicines are being used, and allows you to come to your own understanding and your own choice.
And at the end of it, that's really all we have, understanding and choice.
Yep. Thank you for doing that. That was our first time of using
Chat function.
the chat function to show it on the screen too. Great work.
Nice. Possible drawbacks. These are the things that, well, can be prohibitive. Number one, cost. It's kind of expensive and not always covered by your insurance. Costs can range from $400 to $1,200 per dose. And you may need as many as 12 to 18 doses per year. Again, this is not a one and done. If you have treatment resistant depression and your insurance doesn't cover it, as you're looking at the clinics, prices do range quite a bit, $400 to $1,200 per dose.
So with that, again, they're saying like, you might have to continually take it. So 12 to 18 like doses per year. That's only if you choose to stay on ketamine as a continual symptom relief, right? Another option, which is the one that I would go after personally, I'd recommend is great, take it once or twice or however long you need, but in that space where you're now not underneath that smothering blanket, like that's the time to do the work. That's the time to get at root causes. That's the time to involve other therapies so that you don't have to continue taking it. And so rather than signing up for 12 to 18 doses a year, F that. Like, 2, maybe 3, do the work and then be able to step away from all the medicines, right?
Yeah. And there might be some weaning. You may have to be on other medicines before you step away from them. I never recommend going cold turkey, unless it's smoking. Unknowns. Ketamine hasn't been used to treat depression for long enough in order for doctors to determine if there are any harmful long-term consequences of taking the medication. Nobody's been on ketamine for 20, 30 years yet. Okay. More time and study are needed to truly understand how it affects people over the long term. Treatment failure. Many people with treatment-resistant depression view ketamine as a kind of like a last resort, if you would. So if the therapy fails to improve the depression, it can be very devastating to them emotionally. Have some realistic expectations and have some follow-up support. Have friends, have your therapists, have your counselors, at the ready. Let them know what you're planning. And yay, if it works, but if it doesn't, you still have all those supports ready and available to you.
And realize that like new therapies are always coming around. Like I'm in February testing out, experiencing, benefiting from a therapy that I haven't known of before, that for me feels a little bit more on the cutting edge. Beautiful. It's involving simple things, but it's doing so in a new and novel way that I believe in terms of my base nervous system and the level of stress or anxiety that I experience daily versus like taking it back down to a true 1 or 0 will have substantial effects.
And we'll definitely cover that when Chris comes back and tries it out.
Right? We will. And I'm just sharing that there's always something coming, right? So if this doesn't work for you and this felt like a last straw, it's not your last straw. The connections, the care, the people who love you, like rely upon that, allow that to help support you and realize there's always something new coming down. And we are in some of the times right now where the amount of money, the amount of research, the amount of attention, the amount of growth, the amount of experimentation, the amount of research on these topics is greater than ever before. So year by year by year, you're going to see substantial shifts and changes as to what's available. So stick with it. It's okay. It's coming.
Again, it's not a magic cure-all. Even if ketamine does produce results, it is still important to understand what it can and cannot do. Ketamine will not eliminate all your frustrations and stress from your life. While it may lift some symptoms of depression, the life stressors will still be there, right? If you, you will still need support to help you manage them. So don't fire your mental health provider just yet.
Yeah, right. This is with everything. I've just come in the beginning of my journey, man, did I like search for magic bullets. Oh, I'm just going to do this one thing. It's going to be great. Oh, I'm going to go have this experience. It's going to be fantastic. Oh, I'm going to do this deep work for an intensive thing for a month, and then my life is going to be perfect, right? My life has continued to get better. My ability to be with tragedy or drama or emotions or all the stuff that's happened to me for the last 2 months has increased like more and more and more. And I continue to experience life, and I continue to have challenges, and I continue to grow. There is no silver bullet,
Right.
at least not that I'm aware of, nothing I found. And so instead, it's just what's the next step on your journey that takes you just a little further and a little higher. And that's it. That's what you get. And then what's the next step after that? And then what's the next step after that? Right. And it gets easier and easier as you go on, but you're continuing to go on the journey. It's not a one and done for anything.
If there was a magic pill, I think the Matrix would have been over as soon as Neo took that first pill, right? There
Yep,
wouldn't have been three
exactly.
movies after it and an animated series or something like that.
Yeah,
Yeah.
exactly. Which I like the animated series. Hmm.
I never saw that one. I've seen all the movies, but not that one. So
It's called Animatrix, and it's worth watching. Definitely
okay.
look it up.
Yeah, I'll definitely have to. Maybe this weekend. But
Cool.
yes, no magic pill. If there were, the movie would have been over. What fun would that be, right? Your movie is just starting.
Yeah.
Side effects. While ketamine is viewed as safe in a controlled setting, it can frequently increase blood pressure, produce psychotic like behavior, which may result in delusions or hallucinations. Like that, doing the voice there.
Dun, dun,
Serious adverse
dun.
events are rare because the drug is used at such a low dose. However, provided that you are an appropriate candidate for treatment, that means you've been vetted by your healthcare provider, and your doctor monitors you closely, you could find that it improves your mood. Ketamine can make a huge difference in the quality and duration of life and can be very effective for people who are thinking about suicide.
Yeah.
Okay.
So when we get down to this, right? We got in this in the last episode. Same thing. We'll continue to be like, hey, happy go lucky, let's joke moments. And then there's the I've experienced depression and suicidal thoughts, and had a very challenging experience when I was 16, right? I've been to that end. Um, I know people who've been to that end where nothing seems to matter anymore, and either you want to end it or you just feel like there's no reason to go on. Um, and it's okay. Like, I've been there. And I'm not saying that as I know exactly what you're going through. I don't know exactly what you're going through, but I can tell you that there is a path beyond there. I'm here because there was an incredible man in my life who took the time and attention one evening to share his story and helped me believe that more was possible. And I am indebted and grateful for that man. And it's one of the reasons that I'm here. So all of these therapies are helpful and beneficial. And if you get to that point, and if you are there, number one is immediately talk to somebody. Call somebody, talk to somebody now. Somebody who loves and cares for you. If not, one of the hotlines, we'll share more information about that at the end of this episode. But like, find the reason that it's worth getting through another night, another day, and then explore therapies like this and find one that's going to give you a reprieve. And then in that reprieve, exhale, enjoy feeling good for a couple of days, and then begin to look at what is the work that you can do to ensure that you're able to spend more and more days like this, right?
Yeah. The Veterans Administration, the Department of Veterans Affairs studied in 2013 listed an alarming statistic regarding suicide rate of veterans. At that time, there was an average of 22 veterans a day that were committing suicide, double the national average for civilians. As a result, the VA committed to regularly evaluating the mental health of veterans and providing treatment and suicide intervention programs when needed. One such treatment that was approved at that time was ketamine. The Veterans Affairs had approved both ketamine IV infusions and derivatives of ketamine, such as Spravato, and that's just the name of the nasal spray.
Yep.
That provided fast-acting relief from depression and anxiety. Unfortunately, it is not available for widespread use. restricting the medication for pre-approved case-by-case treatments for therapy-resistant depression. Okay. So when I was doing research on the VA and wondering why it was never offered as an option to me, the VA is very, very careful
Conservative.
and
Yeah.
conservative.
Yeah.
Okay. The studies weren't there yet. I know that a couple of their veterans had been, for lack of a better term, test dummies for this, and it had shown some improvement. However, it wasn't enough to keep it in all 170 hospitals. Right now, it is my understanding that there are only 10 Veterans Administration medical centers that offer ketamine therapy. I am lucky enough to be in driving distance to one of them in Albuquerque, New Mexico. But I know that again, this is a case by case. Got to vet you before they even allow you to take it. Okay. It is also my understanding that if you do fall within the parameters of the VA to use ketamine, they will allow you to go out and use regular ketamine clinics, um,
Oh.
give you a prescription for the nasal spray. Okay. So if you're in an area that only has one medical center in the state, and it's 5 hours away, and they don't provide it, if you can get your primary care provider to write you a script, they will provide it, the nasal spray in that manner. They'll mail it to you. Okay. Again, case by case. You must be vetted by your doctor. And this is, again, for the VA, they're very cautious and very careful with how they deal certain drugs out. Okay. So keep that in mind. And if you or somebody has any substance abuse or mental health problems and you would like some help to find a facility near you, we can go to https://findtreatment.gov. There's a National Suicide Prevention Lifeline, 1-800-273-TALK. That is 1-800-273-8255. Behavioral health treatment locator can be found at https://findtreatment.samhsa.gov. And the SAMHSA just rolls off the tongue. National helpline is 1-800-662-4357. Anything to add, Chris?
I would in sharing this, I also want to make sure that we are fully transparent, right? Of the medicines and treatments that we've talked about, ketamine is one of the ones that I know less from personal experience about than some of the other ones. And so we are relying more on research, and I'm relying on my friends and other people I know who've experienced this and what has happened in their lives, more so than my own personal experience. I've only had 2 personal experiences with ketamine. So I don't want to come off, and I don't believe that we're trying to, but I don't want to come off like we're the expert on this. This is why we're guiding you to get the right people to help you and the right people to help to guide you toward this. It is very powerful for those that it helps. It can be literally life-changing and life-saving for those that it works with, but it's not going to work with everybody, and it's not a silver bullet or a permanent reprieve. It's just a relief from symptoms for a period of time. For some rare cases, the reset of the nervous system has lasting effects. But that is, again, more of an abnormal case than the standard case. So the question I'd have, Rod, is as you've done this, you've done the research on it and you understand it, like, what are your feelings? Like, how do you feel about ketamine as a therapy?
When I started
where does
looking
this fit
at
for you?
Well,
Yeah.
when I started looking at the ketamine as therapy, I was actually looking to see what could be done for PTSD, and because that's where I'm coming from, right? I'm coming from having PTSD for 20 plus years, trying to find different things, stumbling into things that kind of helped along the way. I really wanted to look at it, and being that the VA, my local VA, does offer ketamine, I really was having high hopes for the PTSD part of it.
Mm.
Unfortunately, the VA doesn't believe it's a good medication for PTSD. I couldn't get a lot of research on it. I know that
Yeah.
in 2017 they started administering the IV in select hospitals and did a little bit of research on their own. In 2019, they started pulling it and started offering the nasal spray, which um, wasn't as effective. So I know that they are still doing the research. However, they're not publishing a lot of it.
Yeah.
Okay. Here we are in 2022, and I only found about 3 or 4 articles relating to that and a lot of anecdotal stuff, through newspapers and whatnot. So the anecdotal stuff is fine, but it wasn't research based, and it didn't give me a lot of information other than the VA is a big, massive monster hospital that gives veterans ketamine, makes them feel better, and then
Yeah.
takes it away. I don't believe that. I believe that they are trying to do this in a very careful way and in a way that um, gives people the ability to get better for longer, and maybe it wasn't doing it for them for PTSD.
Yeah.
Okay.
Right. So then when you look at it, my interest in this was around depression, right? And
Right.
then suicidal thoughts and tendencies, right?
Yes.
Coming again, each of our backgrounds and where we come into this. And I begin to look at this and go, wow, earlier in my life, I really wish I'd understood this or knew about this or it was available. It could have
Yeah.
greatly helped some incredibly challenging periods in my life. Like I went through the depression cycle and really, really challenging emotional experiences for 25 years or so,
Yeah.
and didn't have to. But I do
Well,
believe this is a matter of finding the right therapy and medicine for what you are experiencing, right? If you,
right.
we're going to talk about MDMA next week. If you're really looking at PTSD and which medicines are highly effective in that, like MDMA stands kind of head and shoulders above many of the others. Not saying it's perfect
Right.
for everybody, not saying it's perfect for you, but it's like the medicine that best helps cure something along with
Right.
therapy, etc. Right?
Yeah.
Whereas then with depression, especially treatment resistance, this can be one of those things that makes a substantial difference. So
Right.
understand like what you're experiencing. Talk to people about it. Talk to a therapist. Talk to your doctor. Talk to people who've experienced these therapies. Get that, and then make a choice. That choice that is right for you. Right. Ultimately, your life, your responsibility, and
Right.
your empowerment.
Now,
And
just before we go down that route, the PTSD with the ketamine, it was helping with people that had been depressed and had suicidal ideation
yeah,
with their PTSD, because PTSD is one of those beautiful things that it's just kind of like a big pot, if you would, and then we're just going to stick a little bit of everything in there.
yeah,
So even though it was helping with the depression type side of it, it still wasn't. It's not considered a cure for PTSD, and it wasn't considered a cure for it. It was helping with the depression and the anxiety. However, the Veterans Administration didn't see, uh, and I'm not sure. I don't want to put words in their mouth, but for whatever reason, they decided to take it off their shelves and only offer it to a very limited population. I'm sure they had their reasons. I haven't found any publications that explain their reasoning. It might have been just something as simple as funding, because that happens as well.
yeah.
But as I read, as I've read, community care is available for those veterans that are getting their medical healthcare needs met by the VA, and ketamine. You can apply for it. It might be a process. Again, you have to be vetted into that system before they supply
Mhm.
that medication to you. And my understanding is those people that are on it, it is literally a lifesaver.
Exactly. Right. So this kind of goes to like we talked about cannabis last week, and for a lot of people, the reduction of the anxiety and the stress and coming to a place of calm can provide the bandwidth to actually be able to live, and also the bandwidth to be able to dive deeper into root causes. This is another one of those, right? If you do have the suicidal ideation, you do have the depression and everything else that goes with it. this could be one of those things that provides you that space. Spaciousness is so powerful, especially when challenging emotions are very, very present. So I absolutely keep that in mind. I do have a question for you, knowing that we have a few minutes more, but it's after the ketamine stuff. It's not entirely related to ketamine, and I'm wondering if it's an interesting conversation for us to have for a few minutes.
Sure.
So before then, do you have anything else on?
I'm sorry, you just froze for like a
Oh,
second.
boom, I'm back. Before I change the topic and use the last few minutes to actually bring something up I think is worth talking about, do you have anything else on ketamine?
No. I think I'm ketamine out.
Cool. Ketamine out. All
I
right. Well,
invite our viewers, both of you out there, to type in your questions if you have any at this point. We have a little bit of time for Q&A if you choose to.
100%.
In
Why
the
don't you bring us
meantime, we're going to
back
talk about
to
something else.
yeah, why don't you bring us back to like like our beautiful faces up.
Our beautiful faces. Wow.
Yeah. This was something that came up in our conversations this week. Ooh, Rod, and Rod. It's that thought and kind of like the mixed motivations that come with healing and moving past a lot of the challenges that can come from PTSD, trauma, and what's the word I'm looking for? Sorry, I'm having a bit of a brain fart. The
Anxiety.
yeah, not the
PTSD.
no, the disability payments and stuff that come with it, right?
Sure. I think, and as I read into the VA, and again, none of these medicines have been considered a cure all. Okay, there's
Mhm.
no cure for PTSD according to the VA. Okay, there is no cure for a lot of these things. These are symptom reliefs. Okay, so if you have been diagnosed with A, B, or C, and you are currently getting a monthly stipend from the VA to supplement your income, and who can't use a little supplemental income at these days, there's always the risk that you might be called back for another checkup.
Mhm.
In which case, your rating, the amount you get paid, may fluctuate depending on how you do on that checkup. Okay. Um, there are plenty of attorneys out there. There are plenty of nonprofit organizations, such as the VFW, the what is it, the American Legion, and there's a third one that the name is escaping me, but they're actually at the base of the at the Veterans Hospital here in town. They have an office there where you can go and apply for benefits, and you can also go in there and fight for your benefits, right? So
Mhm.
if they made a decision to cut your benefits or to change stuff around on you, and you don't agree with them, you have options. Okay. The idea is that we want to make you better, but at the same time, we don't want to make you worse off. In the pocketbook. So if you start feeling better and you are being honest with your primary care provider, and you say, "Hey, I'm taking a bunch of stuff off the shelf that the VA may or may not agree with, but I feel 100% better." Keep in mind that that might be used against you if you do come up for a reevaluation. Okay, so again, all of these, not one of them is considered, according to the VA, as a cure. These are symptom treatment medications. So take it with a grain of salt. If you do come up for reevaluation and they see that you are feeling better, you're not as depressed as you were, however long ago when you first came in,
Yeah.
just I think I would be honest with them at that point and say, well, I'm taking this, and that, and it's helping with the symptoms and it's helping me live better day to day. But if I were to go off the ketamine, or if I were to go off of this or that, I might be where I started, and I really don't want to do that. Okay. So
And in addition, I think that this brings up like a very like again, it's a challenge. And it's well worth being with, but it's like I can stay in the situation that I'm in, And in this situation, like you can receive like certain benefits, right? There's nothing wrong with
Right.
that. But if the fear of losing those benefits keeps you in a position where you're living with triggers, you're having challenges in relationships, you're depressed, you have suicidal thoughts and everything else, like, is it truly worth it? And
Right.
I can't answer this for you. This is a question for you to answer for yourself, because my answer is going to be different than your answer, right? And if you do some of these therapies, or if you do some of these medicines, or you go through some of these processes and you truly begin to feel better, you truly feel like, I actually want to get up in the morning. I have the energy to get things done today. I'm communicating with people and I feel like my relationships are getting better. Like, you begin to have a life that you can actually fully enjoy. Like, what is that actually worth? And if you begin feeling that way, like, what other possibilities open up for you in terms of a different job, in terms of something with better pay, in terms of starting a company or business, in terms of just being creative and making things and then, possibly selling them. I
Yeah.
share this because I think there's a lot of ways in the world to be able to make money. It's not easy. Not everything works for everybody.
Right.
But if the rationalization and the excuse for not helping yourself, for not getting treatments, for not actually being able to feel better and live a better life is purely money, I'm going to challenge that. I can't make the decision for you. It's your decision to make, but I'm going to challenge that because I believe that we all, like, truly, we all deserve to have joy in our lives. We all deserve to have good relationships. We all deserve to want to be here. We all deserve to do something meaningful. I believe these are birthrights.
Right.
And so I just want to challenge, what are your motivations? And is that truly a motivation, or is that a rationalization that's keeping you from stepping into something that is uncomfortable, that is uncertain? Some world that you don't know because it's different than the hell that you've been living in for a while. And
Right.
I know that world. And if it's just a rationalization keeping you from the uncomfortable, is it really worth it?
Right. Now, on a side note, kind of going along with that, and if you do see a reduction, you can challenge it. And if you're okay with that reduction, say you went from 100% disability to 10% disability, again, the VA does not recognize this as a magic cure-all pill. Otherwise, they'd be popping it into everybody as we're leaving the military.
Yeah,
Um, you know, um, it's okay. It's okay. Life will continue. Life will go on. And yeah, like Chris said, I'd rather be looking forward to life than miserable in a foxhole waiting for my paycheck to drop from above, right? Because
100%.
you don't
Like,
even get
I
to
think
enjoy
of
it.
it, I think about it as like also dependence versus independence, right?
Right.
If you're in the foxhole and like it's just darkness around you and you're just waiting for, like, the little rations of food or the little rations of money to be dropped on you every now and then, like, you're dependent on that system. And the
Yeah.
challenge is that system can change at any point in time as well, right? And you are then adversely affected by that. But if you get the help and you help to get yourself out of the foxhole and you're now back out and you can move around and have your own independence and make your own choices and be like agile and move in the world and create in the world, you have so much more independence and so much more control over the future of your life. And then if the benefits go away because there's a change in the government or there's a funding cut or anything else that could happen anywhere along the way, you're going to be okay. You've got so much more ability to live a truly rewarding, fulfilling life and to do so on your terms.
Right.
Yeah. Just a thought. Again, I'm going to be super clear about this because I know that when I get passionate, sometimes my words like can come out in a particular way. I have no right or reason, nor do I want to make a choice for you. Only you can make your choices. And whatever choice you make for you is absolutely right. I have no challenge with that. I just want to present opportunities, right? If I can present a few options and you choose to walk through this door or that door, then I'm honored that I got a chance to share, like, hey, there's this option over here. There's another door over here. Like, do you want to try? But you're the one who gets to make that choice because it's your life. That's free will. That's independence. That's sovereignty. I believe that those are some of the most important things that we have in this life.
Oh, that darn free will! I tell you what,
Oh man, it's a beautiful thing and it fucks us up.
it does. Alrighty. With that, thank you, folks. We appreciate you taking the time this week. Again, if you yourself or anybody you know you believe would benefit from watching the show, please send them our way. We are on YouTube. We'll be coming back to you live again. Same bad channel, same bad time. Okay, that is Lighthouse Liberation on YouTube, Fridays at 7 p.m. Mountain Standard Time. Um, and if you want to go ahead and send us a message, even if it's with a pseudonym, you don't have to give us your real name. Have questions, anything like that. We're looking to interact with you. For as much fun as Chris and I have, it's a lot more fun when we have audience participation. Yep. With that, thank you very much. Have yourselves a very good night, and we'll see you next week.
Big love and be well.